My top 7 OTC medications that are safe and effective for cats.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
I went to the pharmacy, walked down the aisle, and I picked 7 OTC medications that I use to practice using my own cats. Number 1, for cats with allergies, red inflamed skin, this is 1% hydrocortisone. This is very similar to many of the veterinary creams that have corticosteroids as part of the combination. So if you've got a cat that has an area of red inflamed skin, he's chronically licking, maybe your cat has a food allergy, really rubbing the side of his face, it'd be completely fine to use this topical corticosteroid. You want to be doing that a minimum of twice daily for a maximum of 14 days. Apply enough so you can fully cover that skin lesion. You're doing that twice daily, 10 to 14 days. Number 2, for cats with the cat flu, this is Ultrain. We use Ultrain a ton in practice. We get these little kittens with horrible bouts of the cat flu. They're completely congested, just unable to get air up through their nose. The best thing I found that helped open up their nose again, relieve some of that congestion, was this topical Ultrain. So you're just tilting your cat's head back. You're just putting in 1 drop into each nostril. You're going to be doing that 2 to 4 times a day. Most of these guys respond in 3 to 5 days. Number 3, this is Polysporin with pain relief. Cat abscesses are just so common, or cats getting bite wounds. And one of the initial first principles is, number 1, we're obviously trying to prevent infection. But secondarily, I want you to be able to really flush and clean that wound well. So by using something like this topical Polysporin with lidocaine, the painkiller, it's going to numb the skin and allow you to get in there and flush the wound properly. Say our pretend cat here had a puncture wound over top of his ear, and there's no way, like Murray would never let me clean his ear. I would just lightly cover it with the Polysporin, kind of like that, and loosely just spread that all over top of that puncture. Let that sit for about 30 minutes. Then I'd be able to go in with a syringe and flush that, trying to clean that wound out. You can safely use this 2 to 4 times a day, 7 to 10 days. Number 4, for cats that have red eyes or conjunctivitis, this is Visine. The active ingredient in Visine, tetrahydrolysine, it's a reasonably good anti-inflammatory, can help decrease some of that inflammation that you're going to see with a cat that has conjunctivitis. And especially our cats that have the cat flu. So you're pulling your cat's lower lid down, you're applying 1 drop, you can be putting that in 4 times a day, 5 to 7 days. Number 5, this isn't an official over-the-counter medication, but I got it from the pharmacy. This is Castor Oil. Your cat's shaking his head, scratching his ear, you have a look inside, you see this thick, crunchy black debris. Likely you have a cat that has ear mites. The best over-the-counter treatment for that is it's castor oil. Castor oil is anti-inflammatory, and it's thick and viscous, so it's gonna smother those mites. You can just get yourself a bottle of castor oil, tilt your cat's head back, put in 3 to 4 drops, just enough to fill up the base of that ear, and then rub the base of the ear really, really well. You're gonna be doing this twice a day. The suggested regimen is doing twice daily for 7 days. So 7 days on, 7 days off, and then another 7 days on. And I found for most cats who follow that regimen, this can actually treat and cure ear mites. Number 6, this is the hemorrhoid cream. This is Preparation H. Cats generally don't get hemorrhoids, but our cats do get anal gland issues, and this is a great option. Preparation H works by shrinking blood vessels, acting like an anti-inflammatory. Your cat's dragging his bum, looks like his anus may be partly swollen, he's dragging his anal glands. It'd be fine to apply this topically twice a day. If you've got a cat that has injured his pad, especially if the pads look like they're partly abraded or rubbed off, I would have you consider topical Preparation H. It does a great job of shrinking those blood vessels, slowing down that bleeding and speeding healing. Number 7, this, my friends, is tissue glue. Believe it or not, I use this a ton in practice. We had a veterinary version, but it's much the same thing as this one, and I just picked this in the over-the-counter aisle a few days ago. It's a great thing to have in your first aid kit. Say you have a cat that has a pad laceration, a fair amount of bleeding, you just can't control that bleeding. A great option is you can get this tissue glue out, dampen up, use a piece of gauze to soak up the blood, drop in 2 or 3 drops and just pinch the edges of the pad together till they stick together. It's an emergency, you need to stop bleeding, by all means, just drop in 2 or 3 drops and pinch that skin together. And then the other option in a pinch, if you don't have the special tissue glue here, just get yourself some crazy glue. Here they are, my top 7 OTC medications that are safe and effective for cats. Thanks so much for watching this edition of Veterinary Secrets. Click up there to subscribe, hit the bell to sign up for notifications, and when you click that link directly in the box below, I can send you a copy of my free book.